First, we would like to thank the sponsors and exhibitors of the 2023 NASW North Carolina Virtual Clinical Social Work Institute. Sponsors and exhibitors support conferences like ours so they can meet and connect with attendees like you to talk about their programs and services. Check out the sponsor packet on the conference homepage or online virtual exhibit hall for more information about each of our supporters. Please stop by the live exhibit hall today and tomorrow during your lunch for a few minutes to speak with our amazing sponsors and exhibitors. 25 random participants in the virtual exhibit hall will be mailed a social work t-shirt of your choice. You can access the live exhibit hall on the conference website schedule where you access the conference sessions. Triangle Springs has officially opened a Help for Heroes program offering inpatient and outpatient levels of care. Help for Heroes specifically addresses trauma-related symptoms, mental health concerns, and addictions that may be triggered by experiencing or witnessing terrifying or dangerous events, circumstantial life stressors, and more. Services we offer include evidence-based and outcomes-driven trauma, mental health, and addiction treatment specifically designed to meet the unique needs of active-duty military, veterans, and first responders. We are committed to supporting the men and women of our nation's military who are seeking recovery from substance abuse and mental health issues. Comprehensive care plans support the unique needs of each patient, and dedicated treatment units are available. Addressed are military-specific mental health issues such as PTSD, substance abuse, depression, and anxiety disorders. Frequently, decisions made during deployment have lifelong consequences. Many veterans have expressed a desire to be the person they were before they experienced trauma, and they often try to suppress or avoid memories of the trauma they have lived through. However, for some, trauma symptoms can become so problematic that they result in family discord, divorce, social dysfunction, significant substance use, employment difficulty, physical health difficulties, legal problems, and more. For first responders, including firefighters, police officers, EMTs, and more, maintaining optimum mental wellness is a critical part of remaining active and effective on the job as well as at home. Constant exposure to trauma, life-threatening situations, and the physical strain of working long hours on little to no sleep can negatively affect overall mental health, increasing the vulnerability and risk of substance abuse and addiction. Post-traumatic stress disorder, depression, and suicidal thoughts and behaviors among first responders are also common and believed to be triggered or worsened by repeat exposure to trauma, including physical abuse, death among the people they serve, and loss of loved ones. The term high-risk frontline healthcare workers includes a broad range of occupations that repeatedly expose workers to stressful or traumatic situations. Our frontline healthcare workers may regularly encounter challenging people, events, and working conditions. Under these circumstances, frontline workers may experience job-related mental health, addiction, and trauma issues for which treatment in the Help for Heroes program is appropriate.
The key to my success is being a good listener. So when my hearing started to go, I was concerned that my best skill would suffer. Then I found Relay Conference Captioning. With RCC, I can participate fully in conference calls, video meetings, and webinars by reading live streaming captions using my computer, laptop, tablet, or smartphone.
Relay North Carolina RCC is available at no charge to individuals who are deaf, hard of hearing, or have a speech disability and who work or live in North Carolina. With all of the remote and virtual work these days, what's the best captioning option for individuals who are deaf, hard of hearing, or have speech differences?
Our company uses Relay Conference Captioning for our staff meetings. We can all still work and talk together.
Using Relay Conference Captioning, or RCC for short, we participate fully in video meetings, conference calls, and webinars.
Relay North Carolina RCC is available at no charge to individuals living or working in North Carolina. Go to relaync.com/RCC.
Bryn Mawr Hospital, Holly Hill Hospital, and Old Vineyard Behavioral Health Services work together in a collaborative approach to serve patients throughout the state needing behavioral health and substance use treatment. Between the three hospitals, patients ages 5 through older adulthood may access acute hospitalization services as well as in-person and virtual adult and adolescent outpatient programs. Specialty programs include electroconvulsive therapy, residential treatment for teenage girls ages 12 to 17, a young adult acute unit for patients ages 18 to 26, and an emotional trauma unit for adults 18 plus. To access statewide resources, please visit brynmawr.org, hollyhillhospital.com, or oldvineyardbhs.com. You may also contact Danielle Williams at 919-436-5703.
I may be grown, but every now and again, my inner child comes out to remind me
what my parents taught long ago. They taught me not to fight, not to name call, not to use hurtful words. But then they went through a divorce, and they fought, and they name called. They did everything they taught me not to do. Did it affect me back then?
Of course it did. It still affects me now.
Divorce doesn't have to be devastating. Find an attorney to learn about collaborative divorce at nc-can.org.